IVF is a relatively new science. The first IVF baby, Louise Brown, was born in 1978. Since that time, IVF has evolved significantly, allowing us to improve success rates and offer more comprehensive services. IVF stands for in vitro fertilization and is fertilization that occurs outside of the body. Usually the ovaries produce just one egg per month, but in IVF, drugs are used to stimulate the development of numerous eggs simultaneously. Eggs are retrieved and fertilized in our lab. The resulting embryo is placed in the uterus, and any remaining good quality embryos are frozen for potential use in the future. IVF is a helpful option for people who have blocked tubes or sperm that is not as functional as we would expect, for people who have unexplained infertility, or for same-sex couples or single people who wish to use donor sperm or eggs. You should be referred if you are under 35 and have not conceived after having regular unprotected sex for 1 year, if you are over 35 and have not conceived after having regular unprotected sex for 6 months, or if you are single or in a same-sex relationship and wish to explore your fertility treatment options. You should have blood work, including an FSH, LH, and estradiol on day 2, 3, or 4 of your menstrual cycle, as well as TSH and prolactin. You should be taking folic acid at least 3 months prior to trying to conceive. Male patients should have a semen analysis. Your family doctor or a walk-in clinic can arrange for these tests. Ideally, they should be done before your first appointment, but if you do not have a family doctor or easy access to a walk-in clinic, we can give you a requisition at your appointment. We have an intake questionnaire for you to fill out before your appointment. Same-sex couples, as well as patients who are non-binary or transgender, are welcome at AERT, and we have an intake form for patients who do not identify as female or male. One of our physicians will discuss your history with you and your partner, if applicable, and provide options for your consideration. Your recommended testing or treatment will be based on a variety of factors, including the results of your blood work and other investigations, as well as your age. You may be referred to have a hysterosalpingogram or dye test or hysteroscopy at the hospital to look at your uterus and fallopian tubes. You will have a pap smear and swabs done to test for various infections, and this can be done at our clinic. You and your partner will have infectious disease screening and possibly other blood work if it is not done before your first appointment. Your partner will have a sperm functional analysis, which is a much more detailed test than a basic semen analysis. It tells us a great deal of information, including how many slow and rapidly moving sperm you have. It will help us further understand your sperm parameters and if you require intracytoplasmic sperm injection, known as ICSI, which means that sperm is injected into the egg with a needle. There are quite a few things to remember to do, so we'll provide you with a to-do list. Our nursing line is also available to help answer any questions you have along the way.